name's Rush, and I'm a nurse practitioner here at Stanford's otolaryngology department. Today, I'm going to talk to you about how to use a nasal steroid spray. Nasal steroid sprays may have been recommended for you to use by your provider to help with some difficulty breathing through your nose, maybe some nasal congestion, or some postnasal drip. You can find nasal steroid sprays at any drugstore or pharmacy. Some of them are made over the counter. Generic is fine, any brand is fine, that works. It'll come in a box that looks like this. You want to open up the box and take out the spray. Then, when your head pointed down towards your toes, with the opposite hand inside the opposite nostril, you want to spray 2 sprays inside the nose aimed towards your cheek. And that's because the part of the nose that's causing you to have problems breathing or maybe some postnasal drip is located more on this side of the nose rather than in the middle of the nose. The middle of the nose is separated by a wall, what's called a septum, that has a very thin lining of mucosa on it. If you aim the spray towards that septum and the mucosa, 2 things will happen. Either one, it will bounce off the septum and run out of your nose and will not treat the area that's affected, or it'll bounce off the septum and irritate it and cause you to have some nosebleeds. So again, opposite hand, opposite nose, aim it towards your cheek, inside the nose, and spray 2 sprays inside the nose. Then you want to switch hands, opposite hand, opposite nose, towards the cheek, inside the nose, and 2 sprays inside the nose. Sometimes it helps if you look down and do it, so nose to the toes, and that'll help it get into the nose also. It's okay if a little bit of it runs out of your nose, just as long as most of it stays inside. If you have any questions, please feel free to ask any of your providers here at Stanford Otolaryngology Department. Thank you.